we finally get to turn to my guest who's in the studio today, very patiently and quietly sitting. She's a very good friend, a longtime friend, and she's also a doctor, a medical doctor, Dr. Yvette Lozano. She's here in studio, and we're going to talk about two things about Medicare, or maybe more. But she is she's a practicing physician and also a political activist, outspoken, well-informed. And the reason I wanted to have her in, just a little reason, was between October 15th and December 7th or something, is your Medicare open enrollment period.
Yes.
Okay.
Very important.
Okay, so we're going to talk about kind of not just the choices available, but the politics behind it. So, Yvette, welcome to the studio.
Thank you. Thank you very much. Very happy to be here.
So glad you are here. Tell us a little bit about, I'm not quite where I'm looking at these choices yet, but in Medicare, between this date coming up, we have some choices, or some Americans have choices. Tell me what the reason is it's so important for people to focus on this Medicare choice time.
Actually, that is such a great question, because the problem is that we will be making decisions and we will be asking about choices in Medicare, and nobody tells us. The only thing that we hear is the propaganda from those that want us to sign up for those particular Medicare plans. And that may not necessarily be the best thing for you as a patient. And so one of the things I wanted to mention just really quickly, Debbie, is I wanted to tell people just a little bit about Medicare. Medicare A is the part of Medicare that you receive when you become 65 years old, and it covers all of the expenses that you have when you are actually in the hospital, when you are admitted to a hospital, car accident, cancer, heart attack, stroke. Those coverages are covered by Medicare A. Medicare B is the coverage that you will have when you go to a physician's clinic or when you are going to pay the physician for the services that are rendered. One of the nice things about Medicare B is that the government, after you turn 65 years of age, and this is most people, there are always exceptions through disabilities and so forth, but when you turn 65, Medicare B covers 80% of all of your clinic and doctor visits. So you are left with about a 20% copay. What I will tell you that, every doctor is different. The examples that I'm going to give you today are examples that I've experienced, my experiences with Medicare in the last 20 years that I've been a practicing physician that accepts Medicare, is that a lot of times when patients come in, doctors will simply have a copay, a $20, $30, $40 copay. Very rarely will a doctor go after a patient that has not provided the actual 20% of that visit. Well, something interesting has happened. Obamacare came in, and when Obamacare came in, all of a sudden we lost a lot of our liberties and our freedoms on how we deal with our insurance. Well, the first thing that we did used to be that when you became eligible for Medicare, you got it on that particular month. And if you wanted to change your policies, you could change your policy throughout the entire year. But now with Obamacare and those 1,700 pages that we're under, because it has not been overturned or completely revoked, there's only a very short window where you can actually make changes to your policy. So you have a lot of people that are out there looking for and trying to receive, your Medicare, your Medicare privileges. And so one of the things that I've noticed is frequently when you're in the grocery line or you're in a department store, at the end of the checkout, you'll see people that are waving a flag to get you to sign up for Medicare Advantage. It is an advantage. And this is how propaganda works. Propaganda works by naming things and calling things a certain way so that you're wanting to get it. You're going towards it. And again, this is propaganda. And we've seen this in some of the communist countries, that myself included came from a communist country, and the first thing that the government
Cuba.
did was take over the healthcare system. Because if you take over the healthcare system, then you literally control the population. And so with a lot of these programs, it's like President Obama said, try it and see how it works. Let's pass it and see how it works. Well, if you sign up for a program and you are not well informed, you're stuck on that program for a whole year. And if you happen to be sick while you're on that program, there's no flexibility for you to really switch programs. In fact, in order to change from one Medicare program to another, you actually have to move out of the city that you're in to be able to find a loophole so that you can change your policy. So I've had a lot of people come in and say, well, I was told that you were on the program, Dr. Lozano, or I was told that, this Advantage program is just like all these other programs. So we have traditional Medicare, which I recommend. This is the Medicare where you are covered 100% in the hospital, and you are covered 80% through Medicare B for your doctor visits in the clinics. If you sign up for some of these other programs, that are, let's say, private Medicare programs, then what happens is that organization goes to the government, goes to the federal government and says, I want to purchase this patient for the year 2019, 2020. And so the government gives that private institution an opportunity to take care of your health care for those 12 months.
I got to jump in. Medicare Advantage is a private entity, essentially
not affiliated at all with Medicare.
So competing with the government or providing.
That's right. What they do is they walk up and they say they literally purchase the patient. They take over the patient's care for a certain amount of monetary gain, and that contract is decided between the private entity, private insurance, like a Medicare Advantage program, an HMO or something like that, and then they take over that patient's care for the entire year. Okay? So with Medicare, there's no limits to what you can spend or where you can go. If you have traditional Medicare, you can go to any hospital, you can see any doctor, you can go in any state. But with some of these private programs, you're really limited on how many doctors you can see. They don't normally have doctors in their network, and they may be a small amount of doctors. There are certain hospitals that are not in their network. Now, true, this you also see in private insurance, like Blue Cross Blue Shield, Secure Horizons, and things like that nature. But I think what happens is when patients sign on for Medicare Advantage, they're not aware that this isn't another limb or another branch of the government of Medicare, traditional Medicare. And, the problem that doctors have with these programs is they'll take all of their patients and guide their patients into, let's say, a particular program, a Medicare Advantage program, and then realize, hey, I'm getting kind of limited as to what I can do, what I can order, how often I can see the patient, what they will let me do, who I can send them to.
You, the doctor, are limited, you're saying.
That's right. And the doctor will pull back. When he pulls back, his patients are stuck in the program. He's lost all of his patients. And so the important thing that we want to remember is that the patient wants to have full access to any physician that he wants to see, and he doesn't want any insurance program, be it Medicare Advantage or any of the other insurance programs that we have, telling the patient where he can go and who he can't do. This is the problem with Obamacare. The reason with Obamacare failed was because the patient lost the ability to choose for himself. He wanted to keep his doctor. He wanted to keep his clinic. He wanted to keep his hospital, and none of that occurred. And so in a lot of the Medicare Advantage programs, if you end up with an accident or an emergency in a hospital that is not covered by your Medicare Advantage plan, you are fully responsible for that entire bill. Whereas if you have traditional Medicare and you're traveling and all of a sudden you have an emergency and you have to go to that hospital, traditional Medicare covers every hospital in the United States.
Okay. What does Medicare Advantage claim when they're pitching it is the advantage of having them?
So that is really interesting. I've heard a lot of crazy things on what they claim, but some of the things they'll tell you is that they will include dental, or they will include transportation, or they will give you a membership to a gymnasium. These are things that, are they truly advantages? Are they truly things you're going to use? What really is an advantage for you is facilitating your visit with the doctor, not limiting what the doctor's going to do, not putting a cap on how much money you're going to be able to spend. And in that case, these programs are not good. Now, I have had situations where I've had advertisements of these type of programs on radio stations, and I've called into the radio station saying, hey, you're making this sound like it's really, really a good thing, but this really isn't so great. And the response that I've gotten is, well, this is an advertisement. We're on this TV station, we're on this radio station, but this is paid advertising. And what happens is, these are very smart people. They will channel the advertising to the locations where we are the most weak. And so if you're used to listening to, like, let's say your show, and they like everything that you say, they'll come in with a Medicare Advantage program, and they will then have a commercial during this to entice your customers, your readers, your listeners, to sign on to Medicare Advantage, not knowing that they probably already have full coverage. 100% with Medicare A and 80% with Medicare B. Do we even really need a secondary?
So, Yvette, let me ask you this, Dr. Lozano, let me ask you this. So if you had Medicare, traditional Medicare, and you wanted to purchase private insurance in addition to say, I want my dental or my vision or whatever things aren't covered, can you do that purchase private insurance without endangering your traditional Medicare?
So yes, absolutely. And that's very important. You can have traditional Medicare and have a supplement that comes in to cover the 20% that Medicare B is not going to pay. And some of the things that I inform the patients are, before you make that choice, go see your doctor and ask your doctor, tell me about the amount of money that I'm going to spend with my drugs, the kind of medications that you foresee me using in the future, how much they're going to cost, so that you can kind of gauge if the cost of the supplemental plan is actually worth it. Because what a lot of people don't realize is if you go to see a physician with traditional Medicare, right, and this physician has made a contract with the government that he's going to have a set fee on how much he's going to charge. So I could charge $300 to $400 for an office visit, but if Medicare only allows that office visit pay $120, I'm only going to receive $120. And of that $120, 20% of that is going to be your portion that you need to pay. So we're really looking at about $30 or $40. So a lot of patients that have traditional Medicare are paying $300, $400, $500 on supplements. And what they don't understand is that their doctors are only receiving $30 or $35 from their plan. And if they go to the hospital with a catastrophic problem, the coverage that they're going to get is not through the supplemental program, but through Medicare Part A, which normally covers 100% in the hospital. So getting informed is very important, but the only people really talking about information as far as Medicare are these plans that are out there to profit.
To profit, right. So if you are, this is so informative, so if someone wanted to get straight facts, actual information, besides listening to you, or replay this over and over, where can they go to get that?
I think going to Medicare. There's a 1-800 number to Medicare, and calling them up and asking them just point blank, what hospitals can I go to? What's covered, what's not covered? How much do you pay? What are the physician fee schedules? And all of this stuff is actually online now, which is really fabulous if you do a little bit of research. But what's confusing is these companies that are private institutions that are there for profit stop bombarding people as early as age of 55, letting them know, hey, you want to come here, you want to sign up with me, we're going to cover, it's all going to be done. And before you know it, these older people, which are a lot of them on fixed incomes, are overinsured multiple times. And sometimes being overinsured can actually be dangerous, because sometimes when you go in to see the physician and you have all this insurance, the physician will then decide, well, let's go ahead and do this test and do that test because we can, not because we need it, not because it's indicated, but just because, we want to make sure that we cover all corners and we want to make a little profit. And so you have to be really careful. Sometimes insurance is a bad thing. I can give you examples. I worked in the emergency room through my transition period when I went from my residency program to private practice, and I very vividly remember a gentleman that came in and he had a kidney stone. I could tell because he was moving and shaking. He was in so much pain, and it took about 30 minutes to get him registered in the emergency room. But there was a gentleman that just walked inside, and he actually had a sinus infection, just a little bit of a runny nose, a little sniffling, and he had no insurance, and he was seen immediately in the emergency room. Now, again, that's really not the way it should work. But
he was seen because he was fully Medicare. He was Medicare traditional.
No, the gentleman was seen in the emergency room very quickly because he did not have insurance, and the gentleman that had insurance had to spend 30 to 45 minutes getting approved by his insurance company to be seen in the emergency room.
Okay.
So sometimes having too much insurance can actually be...
Okay, yep. I get that. Okay, so what about, we only have like 1 minute here, but what about Obamacare caused Medicare Advantage and other things to explode?
Absolutely. So the cost has skyrocketed. I'll give you an example. Let's say that you were going to go see your cardiologist. You wanted to have a stress test. That stress test would normally through insurance cost you about $1,800, maybe $1,900. But right now, because of the fact that Obamacare has caused so many problems, I can pull away from the insurance nightmare, contact the cardiologist, and I can get a stress test done for $175 for a patient of mine that's not under Obamacare. A lot of people can't afford Obamacare. It's absolutely unaffordable. It was supposed to be the Affordable Care Act. You were supposed to keep your doctor, and none of that became true. And so people are walking around now with cards that say that they have insurance, but in reality, they are not covered with insurance. And if they do go to some of these clinics that claim to take Obamacare, what happens is they walk in and they never see a full physician. Now we've used the word provider. What does a provider mean? Well, a provider used to mean a full-fledged doctor, medical school, residency program, but now they put in people that are fillers, people that have limited amount of experience, but walk around with white coats and stethoscopes and impersonate physicians. And so a lot of of our people don't know what a provider is or what an ancillary helper is. And the initial thought process of these people were going to help the doctor. But what's really actually happened is these people are being used to make more money for the physicians, in the sense that they are now running clinics unsupervised by themselves and seeing patients who think you're my doctor because you wear a white coat and you have a stethoscope. Very, very dangerous. I think the proof is in the pudding. We've seen the decline and the morbidity and mortality in this country. It's never been seen before, but in the last 40 years, it's always increased lifespan, and now we've seen for the last 2 consecutive years a decrease. I think it's completely correlated with Obamacare. It must be completely repealed. We have to get rid of it completely. Thankfully now we don't have to have the individual mandate so that you have to have insurance, and a lot of people are walking away from insurance companies that steal their money with very high premiums and going towards health insurance like
co-op.
No, it's like a bank account. It's a health savings account where you can put money in and you can use it and you control your money, and so there's nobody that's going to be wiser with your money than yours. Always talk to your physician, have him guide you.
I love that. I had a clip ready, but we're out of time for today. I was going to play the clip No, you were wonderful. That Senator Warren she was kind of trapped at the last Democrat presidential debate where she was asked, how exactly are you going to pay for Medicare for all without raising taxes? And she went off on her talking points. I'm going to stand up for the little guy, and rich people are going to pay more. And she didn't answer, which one of the other people on the stage said she never answered the question. But that'd be for another day, because I really feel like we're just at a point. We all hope when we had the Republican majority back in 2016 that Obamacare be repealed, and it was not. But that's on our to-do list, I hope, in President Trump's second term. Yvette, thank you so much for coming in. Thank you so much.